Welcome to this edition of Pass the Mic, Let's Talk, an initiative of the Africa Centre for Ideas programme through Jade Communications. This is part of a series of conversations on the impact of the COVID pandemic on Kenya especially, but with reference to the rest of the continent and by extension to the whole world. I'm John Sibi-Okumu and my guest is Dr. Asha Mohammed. With degrees in dentistry and public health, and after more than 25 years of work experience, she is now Secretary General of the Red Cross, Kenya. Welcome, Daktari.
Thank you.
Now, where to start? I would say that I would want some clarification on why the Red Cross is involved with the mitigation of COVID, when the branding of the Red Cross is to find a disaster such as a war, a famine, drought, and deal with it. But COVID is everywhere. So why the linkages between the two?
COVID-19 is a pandemic, so it is actually a disaster. And so the Red Cross is actually in the right place. But maybe also just to say that the Red Cross is not just about the sudden onset disasters. Its bigger portfolio actually is in the area of health. So working very closely at community level in terms of building resilience. But unfortunately, maybe you can say the media focus is usually on this sudden onset disasters. If you look at even the Spanish flu in 1918, the Red Cross involvement is very clearly written about it. And so it is actually one of the things that we are involved in, including epidemics that happen every other time.
Thank you for that clarification. Okay, let's hone it down. I know from my researches that you are part of a national task force. So the Red Cross is part of a grouping that is charged with managing the whole response to the COVID pandemic. So in other words, I'm trying to suggest for later questioning that you're responsible or should take responsibility for any number of things. But before I start questioning you more directly, tell us about your involvement in the management of the pandemic.
Yes, correct. We are part of the structures and the system that actually is, you can say, overseeing, but also implementing some of that response, starting with the National Task Force. But also within this task force, there are various working groups. For example, there's one on community engagement, there's another on mental health and psychosocial support. And this one in particular, actually, the Kenya Red Cross is a co-chair with the Ministry of Health. But also at county level, where the Red Cross then is present in all the 47 counties. And we work at that level with the county governments and the national government representation. So we contribute at all these different levels. Maybe also just to say, because of our status as auxiliary to government and acted through an act of parliament, we are auxiliary to both national and county government. So we play our role within the structures.
Okay, I'm following closely. I would like to visualize the Red Cross in action against COVID.
Yes.
Give me some images to make it clear what you do.
Okay, first and foremost, our biggest strength is being present at community level. The Red Cross is primarily a volunteer-based organization. Today, we have more than 217,000 members and volunteers in all the 47 counties. So when it comes to COVID, then our biggest role is actually sensitization of the community, ensuring that we are giving information and the correct information, but also encouraging members of the community to take different actions, whether it's the infection prevention and control measures. But even today, as we speak about vaccination, this is an area we're playing a big role to be able to demystify some of the concerns and perceptions that communities have and encourage actually the uptake of vaccination, including supporting the Ministry of Health in some of the cases to even do the vaccination, because we also have healthcare workers, we also have health facilitators. So we play a big role in this aspect. But more importantly, I would say ours is most of the time trying to reach the hard to reach populations that maybe even the normal ministry system cannot or capacity does not allow. For example, if you talk about areas where there's insecurity, Kenya Red Cross is there. Kenya Red Cross has worked there. And because of the perception, the acceptance of these communities, these are the areas that we also complement government by being able to reach these particular communities. Prisons, we've worked very closely with the prison authorities during COVID to ensure that they have enough isolation facilities, to ensure that the question of mental health and psychosocial support is also taken care of. If you remember, the prisoners had to do away, they couldn't have visits from their families, and the Red Cross came in to ensure that we even provided mobile phones and airtime to ensure that they could keep in touch with the families during this period. So it's quite a whole range of activities, I would say, but always looking for the most vulnerable in the community, whether it's children, it's women, it's young people, it's prisoners, it's people in very hard to reach areas. That is what we're always looking out for.
Thank you. I think you've broached on some of the areas of questioning that I had envisaged.
Yeah.
But I'd like to ask you very quickly, how do you make the choice? Kenya's a big country,
Yes.
47 million people. And there's a sort of hidden agenda in my questioning here. Mm-hmm. Is there a political angle to the response of the Red Cross? So that if, for example, Asha Mohammed comes from Kibra, was raised in Kibra, then if I were to go to Kibra now, there are 1,000 Red Cross vans dotted against your childbirth area. And you've totally ignored my part of Kenya.
Yeah.
So in a country where politics, the whole politic agenda is that if I made great promises to my people, how are you fair, if a 4-year-old were asking?
Yeah. Interesting, and maybe some of the people in Kibra will tell you that I'm not doing enough for the Kibra community, but yes, it's because we are guided by certain principles. As the Red Cross, we are guided, first of all, by 7 fundamental principles, which is something that is applied globally by all Red Cross societies. It's a question of humanity. It's a question of impartiality. It's a question of neutrality. It's a question of independence. It's a question of voluntary service and universality. So mainly, if you then take the angle of impartiality and independence and neutrality, those 3 are really key, of course, with humanity. So we go where there is most need. And how we do that, of course, like I said, because we are present in these communities, we know what is going on in all these communities. Our volunteers are not imported. So you can be a volunteer of your village. You are a volunteer of your county. So you are able to tell us, and we are able to confirm, because we always have to come and confirm. So we even have a registered database of people that we know need one thing or the other. So we are guided by this. Of course, like you say, yes, politics is an interesting area to look at. For example, today, heading up to the elections next year, you can imagine sometimes there's a bit of pressure where, of course, every other politician may want you to do something in their community. But this is what actually helps us to stay focused, to say, okay, there is a problem in your area, we'll come and do an assessment.
Right, okay. I want to go back to this idea that Kenya is also a very big country.
Yes.
Now, and we have different problems in different parts of the country. So if I open my newspaper today, Daktari, I will read that there is a terrible drought situation to the north of the country, affecting any number of counties. Now, it seems to me that if I'm hungry, I'm going to go somewhere where there might be food. And if there's a great bunch of us awaiting handouts of food, then we are more exposed. So what happens to the 2-in-1 situation? When you have drought in northern Kenya and you have COVID, you have floods in Budalangi and you have COVID, you have whatever. You can see where I'm coming from. In other words, you might be overstretched and incapable.
Well, for sure, there is a lot that would need to be done, but we are not the only player. And like I said, we also work through the existing structures, which means that we also work with other organizations. We even have you can say MOUs with other NGOs that maybe work in some of these counties. But we are also very clear in terms of, what are some of the specific priorities that we can actually contribute to. So when you talk about COVID and, for example, drought, for sure we even had to change the way we do work. For example, food distribution. In the past, you would see long queues of people waiting to be served. We don't do that anymore. Since last year when COVID came, we have reorganized, we have developed new methods, and we actually register people before, and we don't allow everybody to come at the same time. We can, let's say we've registered 10 households, and we say, okay, you come for your food at this time. And you'll come and find we have marked the ground, we have put the social distancing, and we have put your package of food there. All you need to do is just to come collect and go. The second group will come maybe at 12 or at 1. So there are a lot of measures that have also been put in place to ensure that actually we try to minimize the risk. Because there's also the risk to the staff and volunteers of the Kenya Red Cross, because we are also part of the same community. So it has necessitated that we change the way we are delivering humanitarian aid as well.
I said at the outset, Dr. Ari, that this is a series of conversations, and if you were to listen to the preceding ones, one of the sort of leitmotifs, one of the recurring themes has been the inadequacy of government. Government has not had a focused policy, government hasn't seen long term, but anybody listening to our interview until now would seem that everything's hunky-dory, you have a plan, the Red Cross is doing this, everything. But I would like to come in slightly more questioningly and saying that what we see on the ground is a chaotic response to a chaotic situation. Is that unkind?
I always like to be a little bit balanced because I think we have the privilege of being able to play at both levels. We are at the national level, strategic, but we are also very much on the ground. So from that perspective, I would say there are a lot of good things that have happened. And like in any response, there are always challenges and there are also lessons to be learned. I think the essence is really about taking this into consideration and always trying to change. I think COVID has tested everyone and it has tested all systems. It is not something we've experienced before, at least in our lifetime. But at the same time, it is not something that we have answers for at every stage. So we continue to discover, we continue to explore, we continue to find things. And therefore, it's very difficult to expect a perfect system. But I think what is critical really is how do we coordinate as a country? In order to reach actually those that need to be reached. And I would say from where I sit, probably my biggest frustration so far with our response is that it's very vertical. We're talking COVID since last year. But within that same period, we have had to respond to floods. We've had to respond to desert locust invasion. We've had to respond to conflicts amongst communities. And now we're responding to drought. So when we continue to deal with these disasters in a vertical way, then there are a lot of issues there. Of course, there are challenges that come in terms of even the target group. It's the same population that is experiencing all this. So having an integrated approach and outlook to all the emergencies that are happening in the country is probably the one thing that I would flag as something I think we can do better.
May I raise the M word, money? Because again, in prior conversations, we just don't have that much money to splash around.
Exactly.
In order, in terms of, and this idea of being highly dependent on benevolence and handouts and the goodwill of others and condemning them for not helping us poor Kenyans and poor Africans. What about the notion of self-sufficiency? I know this is a loaded question as well because I've had access to your magazine, Reach Out, through you, and you had a plan which the words community and youth were key players.
Yes.
They were the ones to take over, but the community is being dismantled by COVID. So basically, the planning that you had, I might accuse you of having, it's been blown apart, won't work. The community won't come together, the young people won't come together. What would you say to that?
No, on the contrary, I think most of the times we've seen, and not only just with this, when you have a disaster, that is actually the time people come together. That is the time actually communities come together. So we have seen a lot of initiatives by community itself. I give a good example. We are distributing a lot of food, and you may have seen that even in the media, but I can assure you that all this food has come from individuals, not from companies or institutions, or it's from individuals. People have come together and have said that, yeah, we need to support ourselves, we need to support our brothers and sisters. Young people, out of the 217,000 volunteers, 80% of them are young people for the Red Cross. And these are our frontline workers. These are our foot soldiers. So they are actively actually participating in this response.
Dr. I did say that, you know, we're meant to sort of germinate a conversation that will go on.
Sure.
So I've got to go through my list, otherwise I'll feel forever guilty of lack of preparation. Short answers, please. But if we could, what are some of the long-term humanitarian issues that may linger for both the medium and short term as a result of the pandemic? As I'm saying, look to the future.
Sure.
You're saying now we're doing our best. Are we going to be doing our best for the next 20 years?
Well, a few issues that may be important to flag. One is the mental health issue, and I think this is the next disaster. And this will stay with us for a long time. And we run an emergency operations center, and we collect data, and we can see clearly from March 2020 to date, the number of people that call in. We used to have a lot of calls in terms of, yes, you know, we've seen a road accident here, or we've seen, you know, this and the other, but most of our calls today are related to issues that then lead to mental health issues, and we have to link up people for support. Sexual and gender-based violence, dramatic increase. And this is going to be for a very long time. And I think we've all seen this even in the media in terms of what's happening.
Dr. I do hear you, but you're saying, you know, in future, people are going to be more mentally challenged, women and young girls are going to be more victimized.
Absolutely.
But would you look to solutions in the long term? Are there going to be village patrol? I'm always a bit anxious about this idea of foreseeing problems, but not foreseeing solutions.
Yeah.
So, okay, we're ready. What should we do about mental health and gender-based violence?
I think the idea is actually, of course, first of all, is to acknowledge that it is a problem. And I think that's where we start. We acknowledge it is a problem, and then we work towards the solution. So number one is, of course, to ensure, first of all, we stop or we decrease the number of people that continue actually to find themselves in this way. So a good example for us is looking at the young people, because when we talk about mental health, a lot of times maybe the impact on young people is not also being seen. And we can tell you again from statistics, a lot of young people today are affected. So we've already instituted programs through our youth program where we are working with young people. When they were out for the almost 9 months out of school, we had programs engaging young people while they're at home, just to ensure that, yes, they get the support they require. If you talk about sexual and gender-based violence, it's also, again, getting to the community, understanding the issue, but then working with women and girls in order to deal with this. So I think it's an issue of doing these things together, because even for an organization that is known a lot more for disaster, we are saying we don't only just respond. We also try to mitigate, we try to build resilience, because if tomorrow there's still another problem, what we want is to ensure that the people themselves at least know the first things they can do to prevent themselves from getting to the next level. So if it's mental health, there's what we call psychological first aid. And we are training both internally and externally that even I, as Asha, I know what my triggers are. I also get to understand at what point do I say, John, I need help. This is very critical, because most of the times we realize that you find people when they're already maybe too far, and then rehabilitation becomes an issue. So I think this balance is what we are looking for.
Right. I think to end, it's as much of a forum for me to ask you sort of, you know, thoughts in my mind.
Yeah.
But in our conversation, it seems to me that I should allow you to have the last word. And given our audience is to encourage us, to give a message
Sure.
to the people, because surely we have a responsibility. You're doing everything for the citizen, the man or woman in the street or the village. What are your expectations of the populace, countrywide, continent-wide, worldwide?
My expectation, and maybe just going back to the beginning of our discussion, is that for me it's clear. The future of humanitarian action is local. And this is where we need to invest. We've had this big debate globally about localization, where donors are like, yes, we need to give money to national organizations. I'm taking it a step further and saying, yes, it's good to build Kenya Red Cross, build the capacity of Kenya Red Cross and Kenya Red Cross to respond, but for how long will we do it? It's not sustainable. For me, localization is getting it even lower, to the lowest unit, and the lowest unit is the community. Today we are talking about initiating as many community-based disaster response teams as we can that can actually respond to a lot of the emergencies. We've tried some pilots here in, for example, Mukuru in Nairobi, and I can tell you the Red Cross does not respond to the same number of fires we used to do, because we have a team in Mukuru that is trained, has the knowledge, has the skills, has even some resource, that if it's 3, 4, 5, 6, 7 houses that are on fire, they will put off that fire. If it goes beyond that, then they'll call the Red Cross and say, this one now is beyond us, we need your help. And I think this is where we need to get to.
We have to stop there. Thank
you.
you, Daktari, for your challenging responses. I think this conversation hasn't ended, and I think COVID hasn't ended either.
No,
so I think there'll be an opportunity for us to talk again and debrief in current. So thank you.
Thank you.
Thank you. And for you who is listening to or watching this conversation, thank you for being part of Pass the Mic, Let's Talk, an initiative of the African Center for Ideas program through Jade Communications. Till next time.